Ready. I'll let you know when. Okay, we're preparing live stream for the Zoom meeting. I know. Oh, it's setting up the meeting for your YouTube live. And slowly, and we're redirecting to YouTube, and it's like in Wayne's World. 3, 2, 1. And we're live.
Hello. Check out my grill.
Oh, look at that. All right, everybody. Welcome back to Progressives of Grad. This is your Saturday Scream. We're live screaming right here. I'm BoTik. This is Screamin Eagle himself reporting live all the way from the other side of the pond. I'm right here live in Oslo, Norway. Screamin Eagle, where are you at today?
Broadcasting from the USA News Desk of Progressives Abroad, brought to you by Progressives Abroad, live here in Delray Beach, Florida.
That's what's up. Yeah, so thanks everybody for joining us today on the show. Don't want to forget to remind you to please like our page, subscribe to our channel, and please share this live stream. Or if you want to share it to somebody afterwards and you watch it, it will be embedded in YouTube forever. So you're more than welcome to share this around. And we want to get as many, listeners and watchers as we can. Don't forget also, everybody, that we do have a podcast. So this will be transferred over to audio afterwards. So if you want, or you missed it, or you want to listen to something we said again, you can always go and check out our podcast. That's on Anchor and Spotify and all other kinds of places where you can listen to podcasts. And don't forget to follow us on Twitter, because that's where all the magic happens apparently these days. So Twitter, all that jazz. Anyway, so welcome everybody. Progressives Abroad in the house once again today. Saturday LiveScream. We were here a week ago, and Screamin Eagle, welcome back to the show.
Very good to be here. Thank you so much for having me, Mr. BoTik. Appreciate it.
Thanks for coming.
It's been another crazy week, another up and down week, another unbelievable time to be alive. But we made it through. We survived another week. And my apologies in advance for any technical difficulties, but I hope everybody enjoys my Screamin Eagle grill today.
Oh, look at that grill, baby.
Got a mouthful of Screamin Eagle right here.
Man, this is what happens when you're on quarantine,
We got a big budget over here, but times are rough, so we had to pare back on the staff a little bit. Everyone's furloughed, including me. So
don't you know?
Tip to the hat to there, but doing great over here, man. Excuse me 1 second. Okay. It has been a continual challenge, and we're starting to see some positive signs of some things, and the adaptation of things, the adaptation of our life here, and what are some normal things that we would have had in the past that we don't have anymore. Well, one of them was yesterday, and so it was my wife's birthday, and instead of us celebrating, it was a milestone birthday.
Happy birthday.
Thank you very much. We did not go out. Obviously, we didn't meet up with friends, a big group of them. We didn't go to a concert. We didn't go out, and like all these things that I had wanted to do for her to celebrate this, and then what we wanted to do overall to celebrate her, are now on hold. So what we've seen, and so my brother-in-law's brother, he has a young daughter who, it was her birthday yesterday as well. And I think they did what's become the thing, and tell me if this is what's going on across the pond too, but what's become the thing is parade birthday celebrations. Have you seen this?
No, tell us about it. Parade birthdays.
In a totally new way to celebrate this. This is part of our new normal here, at least in America. People will get in their vehicles and they'll make signs. They'll paint their cars with the removable chalk stuff. And they'll go to whoever's birthday it is, and they'll drive by their house and basically do a birthday parade past their home with them outside and waving, and they'll sing happy birthday and celebrate, have a little social distance celebration, which is pretty nice. It's just different, it's just so different. But we're
Sure.
still doing things to celebrate. And I think we see that around the world. Like I've heard stories of people with weddings and that they still went forward with dressing up, and they went and wed themselves basically on their balcony, but had everyone join in on Zoom, like what we're using part of our broadcast today. So it's like, you know, these things that we have available to us we're facilitating to be able to have interactions still, but nothing like what we were accustomed to just, you know, a few short weeks ago. And, you know, it's been about a month now really since things have changed and since orders have been issued. And it's been a little bit about a month, let's call it. And what are we at now? Like a month into this thing, you know, what's been a lot of the changes, and that's been some of those daily life changes. And you see a further continuance of that evolution. And I think as we move forward, we will continue to see that. But we all have an inkling and a wish to still see one another and you know, hopefully hug our friends and kiss our family. And you know, I don't know about handshaking anymore. Dr. Fauci says no more handshaking. Trump says no more handshaking. You know, lots of handshaking here.
Nobody wants to shake.
But
Who wants
shake
to,
my hand.
who wants to shake that man's hands?
Good. Hopefully he doesn't want to shake your hand either, because I don't want to shake his. But that will be the new future in the new daily update on the ground. So, like, how are celebrations going on in Europe, and what have you seen, if anything? Like, not necessarily birthday, but anything else?
Yeah, I think it's just not happening right now. I
Wow.
mean, people are, I mean, by law, you're not supposed to be having any kind of gatherings right now. I think right now it's over 10 people. I know
Right.
in Germany, it's more than, I believe, 2 people. You know, it just depends. It depends on where you are. But in general, other than Sweden, we'll get to that in a little bit. Sweden has decided to go rogue on this one. Yeah, people aren't getting together. I mean, but the thing is, you still see people getting together anyways. Maybe not for celebrations. Like I don't see birthdays happening in the park or anything like that. And I mean, with your what you mentioned about the celebration parade, the birthday parade and stuff like that, that's a very nice idea. I think that that's probably, you know, more specific to the U.S. since the U.S. is such like a car culture. You know what I mean?
Very
I
true.
don't know.
Yeah.
You might see it. You might see it somewhere around here too. I mean,
Maybe a bike parade, a
yeah,
bike
bike
birthday.
parade, something like that. Yeah,
Yeah.
I mean, I think the thing is in general nowadays it's still. I do feel that things are loosening up a bit. I mean, more than they even were before. People are just getting loose. And I had this kind of feeling, maybe this projection before the Easter Passover season that we are having right now, that I thought this would be a time where this would be a test for our countries and our cultures and our societies to see, are people going to be able to stay home, or are they going to, you know, just give up and say, okay, now's the time to loosen up a little bit. And I don't see it completely all over the place, but I did see it in the past couple days, for example, going out around town. I didn't go out too much, but I did go out, for example, into the forest. And that people back home, if you don't know anything about Oslo or Norway, we're a country, a landscape that is predominantly forest. You know what I mean? So going out to the forest here is, yeah, the America. So it's not as big of a deal as it sounds. You can enter we have a massive forest. The city is about 70% forest. And it's some place that people usually go on a daily basis or a weekly basis. You go out for a walk on Sundays in the forest. It's very easily accessible. It's about 70% of the city, and you can reach it by public transportation within 15 minutes from my house. If I want to ride my bike over to the forest, to the enter to the forest, I mean, we're talking, 15 minutes tops. So I went out to the forest, and, yeah, you know what? It was a little disappointing, to be honest.
Really? Why?
Yeah, and I mean, I have to say, I was a little disappointed in myself too, because
Uh-oh.
I had a feeling that um people were going to be out. Just knowing the culture around here, I mean, you can't
How's the
keep
weather too, though?
The weather was nice a couple days ago. Now it's really crappy. So nowadays you're not gonna see anybody out, and it wasn't that great. But I in the hot spot zones, like let's say there's some main entrances to the forest. Like think about it. Okay, think about it like this in states terms. There are places in Oslo which are kind of like the grand central station of the forest, entry
Right.
points where everybody gets in. But then there's, if you just go a little bit out of the way, there are like lesser points.
Right.
So yeah, we tried to enter in kind of a place that may have been a lesser point, but there still were quite a few people there. Now of course,
Hmm.
you're still trying to keep your social distance, like all kinds of stuff like that, but there are just these idiots out there that are not respecting the social distance. And one
What are they
lady,
doing to not respect it?
well, for example, you're on a trail, right? You're trying to stay away from people. You're on a trail, and they're just taking up the whole trail. I mean, a trail works kind of like a street, you know what I mean, or any kind of sidewalk. Some people stay if you're going one way, you're on the right. If you're going another way, you're on the left. Okay. Um, if I'm trying to get past you, do not block the whole trail. And yeah, it's like,
Wow.
okay, three friends hanging out, like, sorry everybody, under any normal circumstances, you shouldn't be covering up the whole trail. Under these extreme circumstances, you should be extra aware. And it's something, to be honest, that we complain about. I know a lot of people complain about in Norway, and it also is the kind of lack of awareness that people have, like walking down the street. In general, people are just like kind of like up in the clouds, and that's a whole other discussion. I think people are here, on average, the society is very privileged, and people don't generally have to care about one another on an individual basis, and are kind of like out to lunch and in their own world. But in
Wow.
these very special cases, you would hope that people would go above and beyond that and enhance their awareness. So I don't
Right.
know. Anyway, so long story short, we got away from that scene quickly and found some other side trails and made our way out. We know the forest quite well, and we know how to navigate like off trails and stuff like that. So we got away. I don't feel like I got in any kind of dangerous, uh, contact with any other people, although you never know. But let's say it was kind of similar to like being in a supermarket. You know what I mean? Like, and that's not what you're looking for when you go out. So luckily, we went out. We found a spot where there were like no people, and managed to find a way out of the forest a day later, where there were like no people. So this was very
That's
great.
good.
But yeah, but the thing is, my main beef is that, and of course related to what we were saying about, like, the recent times, this is of course, people are loosening up because it's the holidays. It's a big deal for a lot of people, and when you walk outside, I mean, that's what's crazy about this virus, is things just look normal.
Yeah.
The sun's shining, the trees are blowing in the wind.
Yeah.
I mean, and for the most part, unless you live near a hospital, or unless you live in New York, where they're building the mass graves, or any of these other countries around the world where they're like building mass graves to dump bodies of coronavirus victims into. Otherwise, things look pretty much normal. If you're not directly affected by it, otherwise things look normal. So what I would ask of people is be a little bit more aware of how privileged or how lucky you are to actually have good health right now, and try
Yeah.
not to spread that shit to other people. And I felt a little guilty myself. I thought I was gonna, steer clear of all of that, and I have a little regret over that move. But at the same time, I feel like I did my best. And also to be aware that in Norway, we don't have a lockdown that says you can't go outside. You know what I mean? It says just stay away from people if you go outside, and don't go in big groups of people. So that's ultimately what I was really pissed off about, is when I did get to this kind of hotspot point, I saw a lot of people not respecting the social distancing, and it's a very easy thing to do. It's
Well,
a
do you,
very
do you do you expect to see, and is this in Norwegian culture? Is there anything to do with Easter? Do they congregate big en masse stuff usually, or
Oh,
families get
yeah,
together?
absolutely. Well, I mean, Easter is,
Passover?
yeah, Easter is like the holiday here in Norway.
Oh
It
wow.
is, it is, it's, I would say it's almost bigger than Christmas time. You know what I mean? And
So could you expect to see? And in my opinion, I expect to see a spike in uh, cases after this weekend at some point, maybe within the next 2 weeks. because of this weekend, we'll see a spike in cases. But please continue. I want to hear about Europe, and then I'll talk to you about like what's going on here with that stuff, because we're seeing the same thing.
Yeah, absolutely. So I mean, I said it beforehand. I really do, of course, expect a spike in cases after this. I mean, it's almost impossible not to, unless the virus has like totally disappeared, which it has not yet. So I don't know. I mean, yeah, it's definitely got to happen. I mean, it always happens in connection with like large events. Like it really spiked. It was spiking. I mean, it was coming up strong in Italy and like kind of southern Europe. And then right around the time when we had this winter holiday, which is like big for like Europe, everybody goes on holiday for this week when school's out around February. Everybody, of course, from the northern countries, they went down to the southern countries, and then they spread the virus down there all week long and then brought it back up to the northern countries. And we saw it with Mardi Gras in the United States. We saw it in Louisiana for a while. Spring break in Florida, and you go down, everybody collects, they swish and they swash and they sweat all over each other, and they're, you know, doing all this coughing all over each other, and then they bring it back to wherever else. I mean, it's not rocket science. This is how this shit works. You know what I mean? And that's why it's such a simple thing to stay away from each other. But anyway, so yeah, so should I just go into start going into the numbers over here?
Well, yeah, but first, before that, let's just a PSA to all of our fans out there and all of our listeners, and please, everyone who's listening to us right now live, please type in on the live stream chat.
Yes.
BoTik is monitoring that. Please give us your questions, your comments, your feedback, and if you have some questions for us, we'll take those questions live right now. Especially, you know, what I wanted to hear from our listeners and our viewers is, what have you seen are some differences in celebrations? Like, how are you experiencing celebrations, and what have you seen on the ground in your particular areas? But PSA time here from your friends at Progressives Abroad and Brock Screamin Eagle Broward at the USA News Desk, Mr. BoTik in Norway. Just as BoTik was saying, for in Norway, anywhere else in the world, just stay home. It's so simple. It's just so simple, people. Stay home.
It's the best thing you can do.
Have Easter services with your pastor via Zoom. Don't try to go to church. I didn't try to get together with anybody for Passover recently. Like, we did Zoom Passover. It's 1 year. It's one time. It's better to make it to next Easter, next Passover, than this be your last one, and it really not even be that good anyway, because you're really not getting together with everybody anyway. So no one's celebrating it the way that they want to celebrate it. So use this time to, whoever you might be with, even if you're alone, try to use technology. But if you happen to be with somebody, significant other or other family, close family that you've been hunkering down with in your quarantine shelters, just enjoy the time with those people that you're with, and relish these quiet moments that we've been having, and take advantage of hopefully not having to wake up to an alarm clock, and you know, getting to enjoy time learning more new things and spending time doing things, and expanding our knowledge on topics and ideas and artwork and all the beautiful things that we can do as the great pause, I'm going to call it the great pause, continues on and hurdles forward. So
no, I totally support that. And I think, as a PSA, you know, totally support staying indoors. I know I also was a bit hypocritical by going outside today, and I understand people feel the need to do that, and from my own personal experience,
you played it safe though.
I tried to play it really safe. You
didn't interact with anybody. You weren't in a group. I mean, I take that as a complete separate thing, that because I still go outside, I still walk. We're still exercising, and that's just Norwegian culture. So for our viewers in the United States, maybe outside the rest of the world, as you explained, that's something that is ingrained in Norwegian culture. And I learned that when I was there visiting with BoTik, and that it's all about friluftsliv and the Nordmarka, going to
tell us about
the forest and all of that wonderful, beautiful way of life. So and
the thing is too is I mean, if you are gonna try to go outside, I mean, it is healthy and it's good for your immune system and all these kinds of things. You have to be careful. This is the main point. I mean, you have to, because otherwise, if you're not careful, then the stuff that people are a little bit paranoid about, the stuff that people are a little bit worried about, like the enforcement of like a forced lockdown, getting fines if you go out on the street or something like that, then that's what's going to happen. So
Right.
if you can't be careful, like if you have any question in your mind, you're like, oh, I don't know if I'm going to be able to control my kids if it go, because I had a lot of like kids, like, ugh, I was like, oh, I get it. No, 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 I don't want to, like, not, I'm out of here. I'm out, dip. But so if you have any question in your mind that you can't control yourself while you're outside, if you are not aware, stay the fuck home. If
Yep.
you can get out, get some fresh air, move your body a little bit, do something like that, okay. Like if you can do that, but you also have to be careful. Like I mean, I mean, I don't want to like judge too much, but you got to be careful what you're doing. You know what I mean? Like, don't do anything that's gonna put yourself in danger. That you're gonna have to have the rescue crew come get you, or you're gonna break a bone or break an arm. You got to be very careful about be very careful, be very surgical about your choices that you're making. I think that's the thing.
True.
You never know, accidents happen, but just be very extra careful, extra careful about what you're doing
Very
these days.
true.
Hmm.
Very, very, very,
And
very.
I totally support what you're saying. Just enjoy the little things in life right now, the things that I got an old theory that I like to work with, which is, okay, when you're not doing one thing, well, it gives you the opportunity to do something else. You know what I mean?
Right.
And okay, you know, can't do everything you would normally do right now, and you may never be able to go back and do everything you'd normally do, but it's
Fill it with new stuff, and I
all
think that's
kinds of
what.
new stuff that you can
Yeah.
do, or
But
stuff you
new progressive things, or new things that you can really gain something out of this, instead of just sitting there and soaking in the horrible news that's on mainstream media. Just listen to
yeah.
progressives abroad and listen to us, and
Yep.
you'll get all the information you need. So
Yeah.
now I think this is a good segue. If you want to jump in, let's bring up your numbers here.
All right, all right, all right,
Here's
all
our
right.
update for our viewers and listeners.
Updates for our viewers. So what are we jib jabbing about right now? Let's see. Yeah, actually, I've been talking a lot, so you want to go first with
Yeah.
your
So
numbers on your
okay,
side?
here, let me get the
Get your share screen on.
So from the USA News Desk, this is what we got going on here. Stand by, everybody, and we'll of course voice this out so that everyone can see.
Oh yeah.
All right, I think you're good. Can you see? All right, there, BoTik, back in the command center.
All right. Yes, you are on, baby.
All right, very good. So, United States of America. This website has now become the primary go-to. Um, the COVID-19.healthdata.org, and this now has international projections on here, so I can jump to that in a second. But for the
Mm-hmm.
United States of America, according to this, today is peak resource day. So today is the day that we are at peak resource as far as the amount of beds needed, ICU beds, invasive ventilators needed throughout the United States on a collective measure. Going down, pardon me, projected to meet the peak death amount per day in one day. However, yesterday we topped over 2,000. So this might not be exactly correct, but it's pretty much in the neighborhood. If they're saying projected was 1,983, and I think we had just over 2,000 confirmed deaths for the first time alone of just one day yesterday. So these projections are pretty spot on thus far, it seems like. We continue to monitor the curve and the shifting of the curve based on the measures that have been implemented for pretty much every single state in the continental United States, as far as lockdowns being in place imposed by respective governors. Let's see, projected, if this holds true, so in about a month and a half, toward the end of May, will be less than 100 deaths a day on average.
Hmm.
So we got a long way to go, everybody, but we still need to do every single thing that we're doing. So total deaths now projected by the beginning of August would be just under 62,000 deaths, with a wide scale here of up to 155,000. So now that is one aspect of it, because we're already at, so this needs to be updated. We're over 20,000 deaths, I think, or we're about to cross that threshold. I think maybe you have those numbers, but let me go to the other main source that we continue to see around the world right now, and that's the Johns Hopkins heat map. This is pretty much my go-to as far as accuracy and legitimacy. So
Heating up.
close to 2 million confirmed cases. Can you see this okay there in the command center?
It's looking great.
Okay, thank you for confirming. 105,000 deaths, 390,000 total recovered worldwide. The United States leads the world. Unfortunately, this is a terrible time for us to be number one. Over 500,000 citizens of the United States have tested positive for the coronavirus. So the situation continues to grow here on the ground. Oh, excuse me. As you can see, there's red dots everywhere. It's in 185 countries and regions, so it's literally all around the world. I mean, just look at the map here. The heat map shows the bigger the red dots, the more concentrated there are of areas. So this is where the USA News Desk is based out of for all of our international friends here, where the mouse is. We're here in Palm Beach County. We have close to 1,500 cases, 79 deaths. Miami-Dade County, so the flagship county for the city of Miami, 84 deaths, 6,300. None reported as recovered. So I don't know, that's a weird stat there. I'm not sure what's going on with that. The Fort Lauderdale area, 2,700 almost. I mean, New York, the Northeast is just an absolute mess, as you hear probably internationally, and that we continue to hear about here in the United States. But let's just see, New York City, almost 100,000 infected alone in just New York, which would be almost on level with the entire country of Germany, surpassing the entire country of China. Although, let's take China with a grain of salt, everybody. I don't trust anything coming out of that country. So,
Well, yeah, that's a whole other story.
tune in for a fireside chat with BoTik and Screamin Eagle.
I mean, there's a lot of let's say this: all over the world there is a extreme lack of testing. In the United States there is a immense lack of testing.
Oh, no question. And
I mean, so it's really hard to believe. I mean, it's not even something that necessarily governments are hiding. It's something that we just can't know about because there's a lack of testing. And even if there was sufficient testing, it would be very difficult to know because there's all the cases that aren't being tested. There's the people that have mild symptoms. There's the people that are carrying that have no symptoms. There's all the children that are carrying that have no symptoms. So, I mean, that's one big important thing that people need to understand about this virus, as many viruses, is that it's just very difficult to detect. And yeah, I don't want to stir up too much conspiracy about China though, because I think that whole thing kind of goes in all kinds of directions, both ways, and up, down, left, right.
It does, and I'm not trying to get too deep into that, but personally, I think that this number is way, way, way low and underreported on purpose by the repressive Chinese government. I mean, 83,000. I don't know. In a country of over a billion people.
Yeah, I'm not sure. I mean, we'll have to dig up some facts on that, or some, at least some sources on that for sure. But I mean, it is also it is impossible to know how many people have this virus really, unless we tested everybody.
My opinion again, and worldwide, that this number is way low.
Absolutely.
No question compared. So
I mean, I think a country that's probably pretty good to look at would be South Korea, because South Korea, maybe we can have a look at South Korea, because
Yeah, here I'll bring it
South
up.
Korea is, I would say,
Let's see here.
a country that I'm doubting is trying to, I would doubt is trying to hide any of the statistics, and we don't really have any reason to believe they would. And yeah, go up a little bit. And they've done a pretty fantastic job. They've kind of kept the balance between, they've released apps for testing. Sorry, they released apps so they can kind of track who's infected, who might be infected, and then issuing a lot of tests to people, quarantines to people who can. But they managed to actually do all of this while reducing, flattening the curve, and not having to shut everything down. So,
Well, that kudos to them, and I think that should be the model for how it should be done to really contain it, and from the beginning contain it. And I think they've done that very well. I mean, the Chinese have kind of have implemented some of the same stuff as far as the tracking measures and some of those draconian lockdown measures. But the tracking, the identifying, and then the isolating, those are the key things. And I mean, that's why you see a country like South Korea with only 200 deaths, a little over 200 deaths. And I mean, only 10,000 confirmed because they locked it down.
but I think is that today, or is that total?
This is updated as of today for the whole country.
Yeah, because I think but I mean, yeah, let's see. I'm just gonna check out over here.
Yeah, do you want to load up yours?
Yeah, man. Wow. Really impressive. South Korea, 10,000 confirmed coronavirus cases. It's such a, yeah, I can show the screen. I can show my screen over here if we want to check it out.
Yeah, patch it in.
We patching it in.
Yeah.
Yeah, so here we go with South Korea, everybody. South Korea at one point in time was one of the first countries that was directly affected by the coronavirus after China. Obviously, because of their proximity, there's a lot of traffic between China and South Korea. I can say myself, from being a former resident and worker in South Korea, that they do have a very exceptional healthcare system. I mean, my God, awesome
really?
healthcare.
What's on par with Norway, or what would you say?
Oh, better.
Wow.
Yeah. Yep. I think, I mean, of all the places I've lived, I mean, just because there's something about the way that the system is like organized there. It's very accessible,
Quickly, can you just like give an overview of what that system looks like, maybe in comparison to Norway and then here to America?
Well, I mean, from what I remember, it was a while back now, but from what I remember in South Korea, I think that their system is just, okay, so one thing about South Korean culture is that there is a very strong emphasis on cleanliness. It all starts from when you walk into a room. You always got to take your shoes off. Not just because this is some kind of tradition in South Korea. It all goes back to cleanliness. You don't want to bring your filth from the dirty streets outside of all the human scum and whatever into someone's house or someone's restaurant or whatever. So this is already a very incredible way that they managed to stop disease. Now, of course, this is common all around the world. People do it, but it's more, but that's really like a strong cultural thing. I mean, you go into a hot pot restaurant or something like that, you got to take your shoes off. You put on some nice little slippers and you walk around and stuff like that, but you got to take your shoes off. So I mean, just that as a cultural basis, is pretty impressive. And I mean, let's say this too, South Korea has a lot of experience with these pandemics, so they've managed to build it up, and they've been very effective, so they managed to build up. And then, for example, I just remember when I would go to, I found it much easier there actually to make appointments with doctors. It might have been also because I had people helping me who were Korean. and I didn't live there nearly as long as I lived there, but I just found like, man, the doctor visits really cheap, really clean, like really I just felt like the care was so good, and there was so much care in like the instruments, everything was, it was just like a really nice system. Everything, even how you got your medication, everything was packaged separately. There was just this very heavy emphasis on cleanliness and efficiency. Like I found it very quick to get doctor's appointment there if I needed something.
And the technology is
Technology is just like
superior.
amazing now.
Yeah.
And if you want to compare that to Norway, now Norway is also has a very fantastic healthcare system, I would say. And just for everybody out there, so when I love to talk about healthcare on the show because I myself, I've, you know, not to be like, oh, I know more than everybody else about healthcare. I don't want to sound ever come off, I don't ever want to come off that way, but I have been lucky enough to experience healthcare system in South Korea, Norway, Germany, the UK, Italy, and yeah, I think that's about it. And the United States,
Wow.
of course. So I guess I got about like five significant experiences with healthcare systems around the world. So so it's a good, you know, area to kind of a good perspective of experiences to draw from, at least from my own perspective. So
Right.
in Norway, I love the healthcare system here, although it is a bit slower, and that is a very like, you know when you hear in the United States the politicians that are very anti, you know, universal healthcare, they're always going to say, oh well, you got to be waiting in lines.
Yeah.
To a certain extent, there is some truth to that. And this is always where I have to be like a little bit critical of Bernie Sanders, because he doesn't, he never really talked so much about that, which is answering one of the main complaints and criticisms of such kinds of healthcare systems. So everybody should know all of these healthcare systems work very differently. Germany was different than Norway. Norway was different than the UK. UK is different than South Korea, and they're all different in Canada and the United States. But the truth is number one, here you definitely have access to healthcare, and if you need it now, you can definitely get it. Okay. But if you say, okay, like I told the story before where I had like a problem with my arm, I broke my arm, I got it fixed, I broke it in the US, I got it fixed in Norway, and then I had to get it repaired, and I had a little bit of problem. It took me 2 months to go get that repair. But what people don't keep in mind in the stories, they don't tell you, they don't give you the context about the waiting game, is that like if you need it now, you're going to get it. If you can live with it for a little bit, you're going to wait because you can live with it. And if you always want to, if you want to shell over some extra cash, you can always get it done at like a private doctor here. But if you can manage to wait, if it affects your job for some reason, like if you say, okay, I can't, with my problem with my arm, I can't do certain things at my job. You get a doctor's note. It's all taken care of. If somebody else has to do that job for you for a little bit, and while you're waiting, you know, they pay you, they supplement your income and all kinds of stuff like that. So it's a different system that allows for this kind of thing sometimes. But if I need a doctor right now, I can go to the doctor. I can go to the emergency right now. It's going to cost me $20. I've already gone over my limit right now, which is we have about a $250 equivalent limit every year. That's basically what you pay out of pocket per year. And I've already exceeded that. So everything I do now in the healthcare system is free, you know?
Wow.
Yeah. So anyway, that's a little,
Very
so
interesting.
we'll go in depth on another show about the healthcare
Yeah,
system.
yeah. But no, you have such a great perspective on that I don't think anyone really that I know besides you can even comment on so many different countries. You've personally experienced that, and I've seen some of that firsthand.
Mm-hmm.
But
What I will say
incredible.
about it though is that what, and I will boldly say this, and I know I might make a lot of people angry, but you know what? All of these systems have all been better than my experience with the American healthcare system. For a variety of reasons, which I won't get into deep. We can do a whole episode, but just the one thing to finish up is I'll say, access. You have
Yeah.
unprecedented access in a universal healthcare system, and this is proving very important in times like these of pandemic and global crisis. And I know it's a really big topic, so it's a juicy one, so we won't get too deep into it right now. But just to keep in mind, everybody, that even when this crisis ends, if it ever does end, there's a daily crisis. There's a daily crisis of cancer. There's a daily crisis of diabetes. There's a oncoming crisis of mass displacement of people and all these health problems that will come
Mental
with
health,
mental health. Oh, mental health is a big one. All these crises that we're having are all health crises that could be answered by a universal healthcare system. And whew, that's so access is paramount. So that's the biggest thing. Out of all these healthcare systems, they all have their differences. You can have your gripes, your complaints, and all these things, but nothing compares to universal healthcare. And if I ever come back to run for president, if we don't have universal healthcare by then, I'm gonna hammer that point in.
Vote for BoTik, everybody. BoTik 2024.
20, I don't know, 2030?
2028.
Ooh.
Well, I mean, we got to get Trump out of there. I mean,
Yeah.
I know it's going to be Biden, right? But like,
yeah,
that's all that's left. I mean, again, that's a whole nother podcast. And we'll tune in next time, everybody.
So wait, where were we going with this? Were we going to some kind of facts?
Talking about just the numbers update there. So you were giving South Korea.
Oh yeah.
Another one's up there. If you're going to talk about some European countries.
Oh yeah. And by the way, my bad. I just realized that we were going through that whole discussion, and it was just focused on me. I think you can also control the screen share on there. So if you see that I'm stuck on the screen share, because when we're on the screen share, it usually only shows one of us and then the whatever content we're talking about. So you can always shut that off if you notice that. But no big deal. Because so everybody, so let's talk a little bit about what's happening over here. So yeah, okay, so Screamin Eagle is talking a little bit about, and I'm using Worldometers, which is also a pretty great website. I like to check it out. They're using Worldometers, United States, just to compare. We've got US is on the top. Wait, let me get back to the worldwide one. Yeah, let's go back to the world. So yeah, US of course is on the top, but I just wanted to go over a little bit of also how I like charts. I like these charts and how they compare. So of course we got USA on the top, then we got Spain, we got Italy coming in. Italy's been on the top of the news. A lot of people forget about Spain. Spain's been surging big time lately. France, Germany, and then China, UK after that. So one thing to keep in mind, everybody, that I think is really interesting is, we talk about nations a lot. We talk about nations, but I think also, and I should keep pushing this point, is that I think we're coming soon to find out that nations are very important for like legislative purposes. So like if you say, okay, we got to cordon off this area, then a nation and a border comes into to play as an important element in this ability to section off things and with legal reasoning, legal force. But especially if we look at like Spain, Italy, France, Germany, these are all neighboring countries. They're all part of the European Union. And they're all kind of working together, I would say. Well, I mean, they should be working together more than I think they really are when it comes to this coronavirus situation. The best way we can really work together is just shut each other off of each other at this point in time. And the European Union is making efforts to give relief funds. They just released the other day, I don't have the article up, but I was mentioning it. They did release the other day that they're going to be releasing about 500 billion euros in aid. This is approximately $500 billion in aid to these countries. So aside from the aid that these countries are, the governments of these countries are giving to the people there, also the European Union is giving out funding. So this is kind of interesting. The closest thing, Screamin Eagle, we did lose your video. I don't know if you're still.
Man, sorry, everybody. Technical difficulties.
That's okay.
All right, go ahead.
All right, and by the way, just give a shout out to our live chat. We do got 8 viewers down in there right now.
Hey,
8 people watching. So
thank you.
Please feel free to drop us some questions. I think the best way to drop us some questions right now is in the live chat, but you can also hit us up on the Facebook page for Progressives Abroad or the Twitter feed. I'm checking that some time to time. But anyway, so what I was saying is, it's really when people around the world are thinking about these regions, I want to think more about regionalism when we're thinking about these things rather than nationalism, the separate nations. Because when you look at Spain, Italy, France, Germany, all neighboring countries, I mean, man, that's like one big country. That's the size of, I don't know, the size of Texas or something like that. You know, yeah, don't quote me on it, but you get my point. It's the size of the southeastern United States, and that's what we're dealing with over here. So it ain't looking pretty over here yet, too. We're still surging. But it gets a bit more interesting when you look towards some of the individual graphs. So let's just compare a little bit right now. Okay, here we've got total coronavirus cases in the United States. Still, USA still on a nice gradual uptick here. Now, let's keep in mind, coronavirus, first, from last time I checked, the first cases of coronavirus in the United States were basically reported on the same day as the first cases in South Korea. You know,
Okay.
so and the World Health Organization warned the world, including the United States, and there's a lot of articles now about how, you know, Trump was, the United States was informed relatively around the same time as everybody else that this was a threat, and they decided not to react. Don't worry, we're not the only ones in the United States that decided not to react. I'll be getting there in a second. But one of the hardest hit places, of course, was Italy. So let's check out the Italy curve right now. Okay, so here's Italy. Italy was surging big time for a while, but you can see, okay, now things are panning out. Italy is probably under the strictest lockdown in Europe. Maybe Spain and now France. I mean, it's getting more strict in a lot, especially a lot of the southern countries here in Europe. But I mean, just to show you, this is what can happen if you go into strict lockdown, and it's still not that great. Italy, we've had we've got 19,000 deaths. We got 32,000 recovered. I mean, this virus is vicious, everybody. So it's not looking that great, but it's getting better. It's getting better. Okay, let's take a look over here at Spain. Spain currently today, all right, actually has more cases than Italy now. Neighboring country, 161,000 cases, 16,000 deaths, 59,000 people recovered. Okay, so they're doing quite good in the recoveries. It was surging a lot, but you can see, there you go. Somewhere around April 5th, it started to like slow down a little bit. Okay, so this is looking good.
Yeah.
What else we got? Now, this is an interesting case. Sweden, neighbor of Norway. Okay, actually, first, let's go to Norway. Okay, here's Norway.
Yeah, right.
Total coronavirus cases. Really, really starting to slow down. To be honest, I'm not even sure. I don't think that the people here in Norway were doing even really that good of a job. I still see a lot of people, you know, going out and about, but I guess we didn't good enough because now it's starting to slow down a little bit. But right next door to us, and this is to show you that, you know, nationalism, going your own way and all this kind of stuff is not necessarily the best idea, because it doesn't work out in these cases. We got to think more regionalist based, you know, and that goes for all kinds of social issues, by the way. We'll get into that later. But look at Sweden right now. Boom, up, 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 up. Because you know what? Sweden decided to do nothing.
Yikes.
Nothing. They decided to do nothing.
Uh-oh. Now talk about, I think you were mentioning in our pre-show talk that there's a potential for Norway to implement some of or to open back up, or tell me what was going on, what's happening there.
That's right. Yeah. Okay. Let me find, I'll address that with another article that we have here. Just a second. Yeah. So everybody,
that's scary. I mean, if you guys are flattening out, but now's not the time to change that, right? I mean, what's going on here?
I mean, let's say this. I'm no expert here, but I'm just some guy commenting on the news here, some local on the ground. But yeah, let's take a look at this article real quick. So this is what's happening in Norway right now, and this is going to be very interesting to see how this pans out here. I'll share the screen right here. So this is how let's see how this is going to pan out. So Norway cleared to gradually reopen. But for those of you who don't know it, this is our prime minister over here, Erna Solberg, who, by the way, I just saw walking down the street the other day. On a little side note real quick. So I was just sitting outside for a little bit. And I see this lady walking down the street. and I I said, hey, looks like Anna Solberg over here. And then I realized, wait, that is Anna Solberg right there.
Wow.
And it was very funny because it's very casual, just walking down the street. And then you realize there was two other people at both of her flanks, the left and the right, um, following, well, walking behind her. It just looked like two people, normal clothes, walking behind her. But I guess it was like her Secret Service or her security detail
Yeah,
or
I'd say
whatever.
she also has some security.
Yeah, but normal clothes, but you can see that little earpiece in the ear, and then a little bit off to the side and further off to them. This was kind of in like a public piazza type area, not a place where you usually see cars. You saw a black Mercedes following in the distance. And I
Uh,
was like, no shit, the prime minister's out for a walk. So even the prime minister's going out for a little walk, but I was very happy to say she was using social distance. So that was good. But and this was the day, I think this was the day after she made this announcement um about Norway will gradually reopen. And it's very interesting here because here in Norway it's a very open society, like you mentioned earlier. It's in many ways they love their friluftsliv, they love getting outside. You can't really stop the people from going outside. Winter, spring, summer, fall, it's just part of the culture. Might be a reason why we have pretty much the longest lifespan. Sorry, what do I want to say? Longest like average life expectancy out of any country in the world. hopefully
wow.
that's hopefully that sticks around after coronavirus. Um,
Great.
but anyway, so, and this is something that they did, after we had these big terrorist attacks, this big terrorist attack, which was actually inflicted upon Norway by a Norwegian, crazy neo-Nazi Norwegian guy.
Right.
The government also said, okay, we're not gonna, huh?
Didn't he shoot up the camp?
Yeah, he shot up the camp. He was extreme right-wing neo-Nazi guy that was very angry about liberal kind of immigration policies, allowing more refugees into the country.
Okay.
And he decided that he would take out his anger upon a summer camp that was supported by one of the more left-leaning parties. Very unfortunate, but and he killed 88 people, many of them children and like youth workers and stuff like that. It's horrible. Worst thing that ever happened in recent Norwegian history. Maybe so. Right after that, the government also suggested people to stand strong and like go outside and don't let this hold us back. So I don't know if that's the wisest thing to think about in this case, but she was out there, I guess, standing strong and going for a walk. But and nobody even noticed her. It was hilarious. Anyways, nobody was swamping it. Anyways, but the point is, okay, so I saw it. Anyway, side story. But okay, Norway's cleared to gradually reopen. So yeah, March 12th. Everybody can see March 12th. Measures the government put in force on March 12th pretty much demanded everybody to stay at home. Wasn't a requirement, but definitely stay at home as much as you possibly can. It required all people who can work at home to work at home, closing down of all kinds of services, especially like non-essential services, hairdressers, places to get your nails done, all kinds of stuff like that, and only essential services. So pretty much the past month or so, we've only had grocery stores open and necessities like the pharmacy, yada yada yada. But this is what's going to happen. So April 20th, so that's in about 9 days now. Daycare centers are going to reopen.
Wow.
Let me zoom in a little bit here. Yeah, so daycare centers are going to reopen, which to me is scary because as we know, children are probably the least that are going to socially distance themselves. And at the same time, they're going to be where their caretakers are going to be in there, and then going back to their families and going to the shopping center and all kinds of stuff like that. Coronavirus and up the place. Elementary schools are going to reopen nationwide on April 27th.
Wow.
High schools are going to open up nationwide on April 27th. And then, so.
Do you agree with this?
Huh?
Where do you stand on all this? Is it too early?
I think it's me personally. I think it's too early. I mean, like I'm no pandemic epidemiologist or whatever you call it. I'm no virologist. But to me it seems way too early. I mean, I don't know. using I think, and from what I've heard from a lot of other scientists that I've heard, been reading their material and whatnot, schools are the first place that should be shut down in advance. You know what I mean? Before shit gets out of hand, you should close schools down, because it's the one place where you don't really see the virus taking a hold of people so much, but where it can so easily spread. You know what I mean? Kids, they're not gonna stay away from each other. They're slobbering all over each other. They've germ, picking their nose, scratching their butt, all this gross stuff that kids do. I know. I've been a teacher. It's a disgusting place. And it's a place where teachers are getting sick all the time. So, and then you take those germs home, you infect your parents. Yeah, I think it's a bad idea, because it's immediately I already saw how people start letting their guard down over the Easter celebration time. And it's gonna I think it's gonna domino effect. I think it's gonna snowball into this people letting their guard down,
Overall,
overall. Now I know we're flattening the curve, and maybe because one of the things that they said in this article too is that there hasn't really been a lot to say about how they really came to this decision. Now there was like a commission on it, and the commission, yeah, you can see right here, the commission was made up of 8 members from the State Statistics Bureau, Norway's central bank, the Norwegian University of Science and Technology, Oslo Economics Organization, I guess, and the Finance and Trade Ministries. So as you can see, there was a lot of strong influence here from financial organizations to get this show back on the road. I mean, what do we see? We've got so let's see. We've got the Norway Central Bank. That's 1. We've got Oslo Economics. That's 2. Finance and Trade Ministries. That's 3. And the health. Maybe it's like 50-50. I mean, let's be real. This is Norway. This is the country with the largest sovereign wealth fund in the world. Only second to it's crazy. If anybody can sustain life for a small population of people, it's Norway. And I don't know. I don't know what they're thinking. I wish they would have given a bit more explanation about it. Maybe I missed it. Maybe I missed it. But from what I heard, there's not a very strong explanation about why they decided to do this. Of course, everybody wants to get life back to normal, but life is not going to get back to normal. This is
it'll be a new normal. But I think just looking at who those people are, I mean, that sounds economically driven to me.
Sounds very economically driven.
And yeah. I think that's the same thing here in America too, and why Trump continues to want to get the country back open. And I think a lot of governors and primarily Republican or Southern states feel the same way. But I mean, and that's important. I mean, we do need to start eventually having the conversation of when and how and what are we going to implement and what needs to be done in order for us to move forward. And I think here, even Dr. Fauci has been talking about that of recent, and we need more testing, plain and simple. We talked about this earlier in the broadcast, is that we need more testing. We need to be able to have quick, efficient, reliable testing, not just taking people's temperatures, but testing people to see if you have it, doing antibody testing. And then until that's ramped up, there's no way people are going to be comfortable going out. You can say the country's open all day, yeah, it's open, go ahead, start going to church. But really, I'm not doing that at all yet. Like, I'm not comfortable doing that. I'm going to have to get over that. I'm going to have to work toward that. And like, I'd never have been that type of person where I'm always one to go into a crowd and mix and mingle and, that kind of thing. And like, now I'm even afraid to go to the supermarket. I haven't been inside of the store in weeks.
I'm with you, brother. I feel the same way. I feel like, I mean, I don't know. I think we had some discussions about this virus before shit really hit the fan. You know what I mean? I think we were having some so I think maybe we're both of the same mindset of, not necessarily we're not following the crowd necessarily. And we like to hang out with the crowd, but not following the crowd. And maybe a little, had a little bit of preemptive knowledge or foresight about the situation. And I think going out of this situation, I mean, if we are going to go out of this situation, if we do make it out of this situation, it's not going to be a new normal. And me personally, and let me know if you agree. I mean, the moment that the government says, okay, things are back open, I'm not comfortable. I want to wait another month. You know what I mean? Really? Like
Yeah.
because at least the first time around,
Yeah.
because next thing you know, shit's gonna hit the fan again, and it probably will. So I think with Norway, and then I think this is a good segue into our lightning round conversation about the new normal and stuff like this. Is that I think with Norway, I'm pretty sure they're taking a calculated risk here. You know,
Sure.
I think they say maybe their healthcare they've worked out the kinks in the healthcare system. They probably ran the numbers, like the ratio of people versus economy and all kinds of stuff like this. And I think they probably taking a calculated risk. They're like, oh, it's probably going to go up a little bit, but maybe we can handle that a little bit better. And I don't know. I don't support this idea. I think that nobody's life, no matter how young or old or whatever they are, I think nobody's life is worth you know money, saving money.
Agreed. And if you can you see my screen here?
Yes, we're
Okay,
back.
so just to show the contrast of where we're at, and now given and for our viewers and our listeners, what we're looking at here, this is a article from the Detroit Free Press, so part of the USA Today network, pretty reliable source, pretty even middle of the road source. Whitmer, Governor Whitmer here, I believe that's her if I'm not mistaken. So in Michigan, she ordered a ban of travel between residences with a few exceptions. So this is as of the 9th, with updated yesterday, the 10th. So you are not allowed any longer in the state of Michigan. You cannot cross the street from your home. You cannot go visit friends or relatives inside the state, or go to your cottage up north. Limited exceptions. So this extends, and she has this expiring on May 1. So kind of in line. I think the rest of the country is becoming in line with what President Trump has ordered as far as the national stay-at-home request to end the end of this month. So we'll see where we're at. But I mean, just shows we're definitely, you guys got it first there in Europe as it made its way from Italy and then throughout the rest of Europe. We have seen that it came from Europe over here. They've done tests of people who have gotten it in the Northeast, and the strain is the same strain of virus that came from the European region. So that is now made its way through the United States, which is obviously a massive, massive area to cover. So let's hope that this ends on just May 1st, and let's see how people really react to that. I mean, look at this. All public and private gatherings of any size are prohibited. Any size.
Yeah, it's what's got to be done, I think.
I mean, wow. Outdoor recreational activities are permitted as long as they're taking place outside of 6 feet from anyone else. Now, to me, I'm here with my wife, right?
Yep.
And would I be stopped? Would I be issued a citation because I'm working out with my wife? So it seems as if violating the order brings a civil fine of up to $1,000, so no jail time. It's still okay to travel to visit a state park, so they still have state parks open. It's a little backwards, but not to go to a cottage or home. Strict measures are needed for another 3 weeks as the state attempts to control the spread, blah, 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 blah. I mean, everyone's facing a public health and economic one. So I get it. And I think this plays into what we've talked about in previous broadcasts today, just overall. I mean, we got to get the health crisis under control, and then if not, the economic crisis will go on and on. I mean, we're going to see as we continue to move forward, we're going to see peaks and valleys. We'll see an opening, but then we're going to see a shutdown again. But that relies on testing. We need better testing. We need more testing. We need different kinds of testing.
Yeah.
Until that happens, I'm really not comfortable leaving my house.
I'm with you, man. Well, I mean, the thing is too, and
The
I
big
mean,
gatherings.
we need more testing. I mean, I think right now, I know in Norway is one of the countries with the highest amount of testing per capita, and I still think it's not enough, but it seems like it's helping. But I mean, the other thing is too is you need to, what are you going to do with the testing? Because if we look at how some countries have been taken care of, for example, South Korea, testing basically came with an app, um, and it was very helpful. It was super effective. You know what I mean? You have
Right.
this app, and then every time you went somewhere, swipe your card, or other people that had this, you could swipe your card, and then that grocery clerk or whatever would be kind of connected, and then they would say, okay, you're at low risk, high risk, medium risk, or you got it, you need to be quarantined. So I mean, I know this is kind of going back to our previous discussion about civil liberties and stuff like that, but it's something that we're gonna have to reckon with as we move on into the future, as we become increasingly connected through travel
Or
and
reconnect.
transportation and all this stuff. Is
Yeah.
we have to reckon with this. What are we going to be comfortable with? Because to me, on the surface, this I know that governments are tracking us through apps, and services are tracking through us apps, and advertising companies and Amazon and all these places are tracking us through apps and stuff that I don't really prefer. And of course, this app would probably have to be opt-in or something like that. But I know they're introducing one in Norway too right now. It's not required, but it's actually created by a Norwegian company, and or I don't know if it's by a Norwegian company, but they're testing it out in Norway because they believe that Norway is a country where people have a very high trust in the government, so that it would be a good place to like test out this new app, because they actually feel like it would be successful here. Like this company predicted that about 70% of Norwegian people would download this app, simply on the fact that there's like a very strong social cohesion here. Um,
Wow.
so yeah, it's very interesting because these are the things that are going to help us. And I thought, it's like we got to wrestle with these ideas, because I thought to myself, in the future, um, things are going to happen. Climate change is going to get worse. You know what I mean? Would we be comfortable with an app that we had to like check into or whatever, or scan every time we recycle, for example?
What would that get us though?
I mean, this might even exist. Like, if anybody knows about,
Incentivize it?
maybe I don't know, because I mean, okay, let's say so, like, because this is where I think this whole coronavirus situation should go. Like, the lessons that we should learn from this is how to connect this kind of global preparedness, global outbreak, all this kind of stuff in the future. Because I mean, a virus is terrible, and it can like wipe out a whole world. Basically, it's like so could a nuclear bomb. And most definitely, unless we make some serious changes, most definitely climate change will do this. So like, what if we were required as our civic duty, basically, to, just like we're required to go to the speed limit, or we're required to carry car insurance and stuff like that, what if we were required, say, to carry something like an app or whatever that tracks our carbon footprint? You know what I mean? And you would get fined if you didn't, if you did not comply with the carbon footprint calculator, because this is actually extremely detrimental to other people's health. You know what I mean? I I I don't know. You know what I mean? Like, I think stuff like this would actually solve the problems. You know what I mean?
Yeah, but that's, to me, that's an invasion of privacy. And I think privacy laws, I think there'd be a big fight for that here in America in court. I get where you're going. I see where your mindset is. And
Mhm.
I mean, the heart is there, right? But like the practical side of me just says, I mean, I don't know if that'll fly here in America. I don't think,
I don't know
and
if it'll fly anywhere. Yeah, I mean, I know even this app that they're like introducing here, it's opt-in. You know what I mean? Like, you don't have to download it. You know what I mean?
right, people aren't
Uh,
involved into that shit here. There's no way. I
mhm.
mean, people just don't care. And may look, maybe this is what we've talked about previously and what we'll continue to talk about, especially as these things take shape over the next couple of weeks and months. But what is our new normal? What will constitute our new normal? Where is the new threshold? The line has now been completely blurred, and we have given up ourselves to everything that we are doing right now for the sake of our brothers and our sisters and our neighbors and just humanity overall, right? So now what is that going to look like on a regular basis? And I think that has to be discussed. I mean, you have to be able to track things, and maybe what comes of it might not be right away when it comes to maybe like a carbon footprint tracking or you know, what you were proposing, but maybe down the line it will. I mean, I think if you implement systems that work, and let's say controlling or limiting the exposure of a virus to a community or a group of people, then maybe some of those principles, as long as they're not too invasive, and we're gonna give up more rights. I mean, we already have right now, but like we're gonna give up more. We all expect to get everything back that we had previously, but things aren't going to be the same. Let's just be real. And what is that new normal going to look like? Again, just like what happened after 9/11, we gave up some of our rights in going to the airport. I mean, we were just talking about this prior to the show, that we used to go run down to go see our grandma when they would come off the plane, and like those things are, you know, those are gone. Those days are gone. So what is that going to look like? And this is going to look so different. So, but that's an important topic, and I think that flows into what the new normal is going to look like, and how is that going to really impact our day-to-day life, and are we going to have scans before we go in somehow? Is some new technology going to come out? And I foresee this, that there'll be something we can't see sitting here right now on April 11th that might come a few months from now, where is it okay to go into a building? Is it okay to go to a sporting event? Is it okay to go to a concert? Is it okay to even go to work where there might be, you know, 1,000 people in the tower that I'm working at, you know, downtown? So it's those kinds of things that we're not there yet. And it's going to be slow. We ripped everything away in a blink of an eye. And it's going to take a lot longer for us to be able to get back to what that was, until we have those things in place. And I think people want that. I think people want to get back. I think people want to move on with their lives eventually, and get back to being able to see people and not have to think about this terrible thing. But I think people also need to sober up and realize it's going to take a lot of heavy lifting and a lot more sacrifice moving forward in order to make that happen.
Well, I mean, and the thing is, dude, is I think that, and I would really like to stress this and get this idea out there as quickly as possible, as widely as possible, is that there will be there's a, I mean, I don't really know what normal is. I do think that normal is a kind of fantasy in general, and it is super, super relative to everybody's individual situation. And we cannot, first of all, we cannot expect things to go back to normal. They will never be the same. Just now, when September 11th happened, people are like, oh, I want things to go back to normal. They never went back to normal. We were able to rebuild some buildings, you know what I mean? But this is bigger than that. I mean, let's be real. That was the only possible kind of like comparable thing that happened in the Western world in recent times that could be comparable to like what's happening now. And this has shook the world, the entire world, you know? So I mean, I really would like a lot of things that need to change in politics. You know, why is it that we don't trust our governing bodies? These are things we have to think about. I mean, there's a million reasons why we don't, of course. You know, why can't we at least trust them more? You know what I mean, with our well-being and stuff like that. And there's very good reasons why we don't. You know what I mean? There's very good reasons why I'd be like, I don't want to freaking download this weird app on my phone. And there's also a lot of illusions that we live in. We live in a ton of illusions that we were living a normal life. Nah, dude, I'm sorry. Facebook, #1 data collection app ever. All the apps that we have. I mean, dude, the CIA used to have spies to figure out all this personal information about us. The FBI, all this stuff. Dude, FBI, man, this is a fucking Facebook investigators. I mean, it sounds like it's no conspiracy. I mean, it's just the real deal. We give up all of our information voluntarily. But what I mean is, and going kind of back to this idea of regionalism and how we are all connected and stuff like this, I just want to keep on stressing this because we're going to have to reckon with this now. I mean, that, for example, I think a big problem in America is that people have this fantasy that they're exceptional. I think a big problem in Europe is people have this fantasy that they are privileged. You know what I mean? And also, but I mean, very privileged. For example, like people are just like, people in Norway are just like, huh, I mean, okay, it's been about a month now and it's Easter. I think it's about time to wrap this thing up. You know what I mean? Like, I want to go enjoy my life again. You know, it's like, nah, dude, like, it may never be like that because that maybe never was how it was in the first place. You were just kind of riding that out because we had the privilege, we had the exceptional situation, all this kind of stuff. To be able to, and so things are not going to be normal and not going to get back to normal. We're going to have to do things. We should put ourselves in the mindset where we are caring for each other more and on a global basis. You know what I mean? I mean, there's already been a lot of talk and about how there needs to be more of an emphasis on like a global healthcare system, or at least how different healthcare systems are working together globally. You know what I mean? Because as we can see, I mean, there's no way you can keep these things from spreading unless we want to get totally nationalistic and, like, you know, build walls all around the world again.
Well, there are definitely some people out there that would love that, but that's just not the world that we live in now.
Yeah, I mean, that's the thing. We have to reckon with the actual, not the fantasy world that we live in, not the American dream, not the Norwegian dream, not the all the whatever supremacy, who's the best country or whatever. We have to really reckon with the fact, and something I've realized for my whole life, for many years at least, but I think a lot of people still haven't reckoned with, is we live on a globe, we live on the same planet. Maybe we live in different worlds, you know, different cultural worlds and stuff like that, but we have to find a way to work together. And I mean, that goes for all kinds of people around the world. That goes for, you know, exceptionalist American dreamers. That goes for, you know, Taliban Islamist extremists. That goes for like all these things. I mean, this is very idealistic, but this is the only way we're going to survive. You know, it is really the only way we're going to survive, you know, is if we start working together. At least the majority of people and the majority of like countries start working together. And that, some people will consider that to be infringement of rights and blah blah blah, but I mean, it's because we have to connect. Maybe we have to give, you know, create systems that work together, but it's going to be the only way we can really survive in the future.
Well, from let's just look at history. And in 1942, I think it was, there were already, FDR was already having discussions with other leaders, you know, Churchill and the like, that they wanted to create, and they were already thinking ahead. What, you know, they're living in the moment. They're obviously making military plans to take Europe back and take Asia back. But what are we going to do afterwards? And this was when the idea of the UN was born, and NATO, and all these other regional or worldwide alliances that keep us in check. And it's going to have to be something on that kind of scale again. And maybe you already utilize the platforms and the institutions that are already in place to be able to implement something like this. But you need to have a global pandemic panel, or, I mean, I know there's WHO, but there's got to be more done for it to be a coordinated effort, especially with how integrated our global economic system is. And we've already heard of here in America, Trump stopped, I don't remember the exact count, but there was millions of articles of masks and other items that 3M was manufacturing here in America, but had to deliver to customers in Canada. But Trump said no, because under the Defense Protection Act that he enacted, the law that was from the 50s, that, you know, to make the ventilators and just keep everything for us, our own supplies. I mean, our neighbor to the north, our great neighbor in Canada, he shut them off. But they came to an agreement. They agreed to send them the items. We were getting other items from China that were being brought in to kind of like smooth it out. So he was okay with it. But it just shows you, and I think the premier from Ontario, he had said that we can't rely on America. We can't rely on other people. We have to be self-sufficient, and that's sad. I mean, that's sad because like you almost need a global effort to combat this and to keep it from happening again. So, have there been any questions or comments on the?
Yeah, I was looking. I don't think we've had we definitely have some people watching, but we have not had any questions or comments today. Everybody, I know we're gonna wrap it up pretty soon, but please, we invite your questions or comments. I'll just check on our Facebook page real quick to see. No questions or comments. I guess we're just entertaining the crowd today.
Very good. That's fine.
That's good. But I'm very happy to see that we've had a pretty consistent 8 people up in the YouTube stream today.
Nice.
So that's awesome. That's better than our 2 last time. But we have had a lot of people viewing afterwards, which is fantastic.
Almost 2 views on our last one. So thank you, all of our fans out there. Thank you so much. We appreciate the love and support.
Thank you very much. Yeah, we're gonna wrap it up in a few minutes. There's some closing comments, maybe. Is that like, yeah, I mean, I know it sounds cheesy and I know it sounds very idealistic, but we really do have to start working together. Like, these old, bumper stickers you see on the back of hippies cars in America, like, we're all just like one world and all this kind of, but I mean, the good thing is that a lot of these ideas, and thanks in many ways to like Bernie Sanders and other outspoken people, that we have brought a lot of these ideas more to the forefront. I mean, I'm definitely of the opinion at this point is that, I mean, all this working together has got to start neighbor to neighbor. It's got to start state to state, country to country, all these kinds of things. But we really got to get it into our freaking heads before it's way too late, because it's almost way too late already.
Yeah.
I mean, let's be real. It is extreme. I think the egg is on the face of the US right now as a major world superpower, being the most infected country with no end in sight at this point. I mean, it is extreme humanitarian malpractice that we first of all, our leader did not take heed nearly early enough, and there's nobody else in this world. If you are actually the leader of the quote unquote greatest country of the world, which I'm sorry to say, I know I'll sound very un-American saying this, but that's kind of a joke. I mean, there are many great countries around the world. We are an awesome country, as many others are. But I think we all need to work together. But if you are the leader of the supposed greatest country in the world, what the hell are you doing? What the hell are you doing not taking heed to these warnings and trying to protect the people? And why are we not leading the world in this? Why are we getting here caught with our pants down? So if we are still, after all of this, not able to support something like a universal healthcare system, which would very vastly like decrease the amount of problems that we're going to have from this, you got blood on your hands. I mean, like literally people are dying because we don't have a universal health, like extra people that could have been prevented from dying. I was hearing a lot of stories when I was watching Democracy Now!, which is a fantastic news show, and I very highly support people watching Democracy Now! Rather than a lot of bullshit mainstream media news sources, although we all got our issues with all our news sources. And they were saying there's all these accounts now of people being just found dead in their houses and dead on the street. And it's like they're suspected that maybe they would have had coronavirus, but we don't even know because they couldn't go to the doctor. They were afraid, whatever. They didn't want to get charged the fees, whatever. I'm saying it is extreme, not only malpractice to the people living in the country, that we don't have a universal healthcare system at this point that could prevent these kinds of deaths, but it's also malpractice to the world. The United States, if you want to be the greatest country in the world, you got to have the greatest healthcare system in the world. And I don't mean just saying you got the greatest healthcare system in the world, because it's obviously not the case. The pants are down, everybody. We all see it ain't working out. We got to improve that shit. And it's malpractice to the people living inside. It's also malpractice to the rest of the world. As an economic giant, we have the ability to make or break the world economy, I mean, this is severe irresponsibility. So it's not just on a level of oh, we should all get along and everybody should be better, and oh, I idealistically want that everybody has healthcare. It's like there's blood on your hands, there are literally people dying, and at the same point in time, there's also economies falling apart that can be directly related to our own economy in the United States because of this malpractice. Like people dying all over the world, people getting coronavirus all over the world, but there are definitely systems that have been taking care of it better in this case. So we really need to learn our lesson for this. And that's my final statement.
Boom, mic drop. Let it be. But no, you make some points there, and some good points, and I think that there's going to be some obvious lessons that we're going to be able to look back on. And hindsight's always 2020 when it comes to anything in life, but there were definitely some obvious missteps that happened initially here in the United States that there could have been a bigger push on certain things to get in front of it. And I think now what we've
Deadly
been doing
missteps.
is, huh?
Obvious and deadly missteps.
Oh yeah, yeah. I mean, for sure. And
Mm-hmm.
I mean, there's plenty of blame to go around. I mean, we obviously know where the buck should stop in Washington, but the things that need to happen to make sure that this doesn't happen again are hopefully what the lessons that we will learn out of this. And I think we're doing the right things right now. We still have a lot more to go as far as getting the proper equipment to the people on the front line, getting the proper PPE to the nurses and the doctors, and making sure that our grocery workers and all these amazing unsung daily heroes, our postal service people,
Absolutely,
food service, all these wonderful, amazing people that are keeping us alive, basically, the ones that aren't sick and the ones that are sick. There has to be some fundamental changes to what we're doing and where we're going and how we're doing it. And that story will continue to play out over the coming weeks and months. And what will that new future look like? But I think that the important things, like as you said, yeah, we need to have better healthcare access. We need to have a better coordinated effort. I think a lot of the issue that we had here was that, Trump played the card of what an American president should usually do when it comes to law and so forth, and setting the law in a way is leave it to the states and let the states deal with it. But in this kind of thing, I mean, you've had states bidding against each other, and then now the states are bidding against the federal government for supplies. Like, I mean, it's
ridiculous.
Just unprecedented and unbelievable and unfathomable that we could be here and in 2020 in America. And I mean, I still think we're a great country. We're a great people. We care. There's been a lot of beautiful, amazing stories happening here in this country of people coming together, companies coming together, communities coming together, taking care of each other, taking care of one another. So we still have the heart of gold. And I think we're, as much as we are a polarized nation, we still do somewhere, there's still some glimmer in the majority of us that we are one and that we are united and that we have to work together, especially in something like this. We got to put partisan politics aside and partisan thought process aside, and we need to really work for the common good, which right now is our lives and our literal safety. So I think I'm hopeful for what the future will bring. We still got a long way to go to get there. We still got to get through. Let's make sure we keep that curve flat. Let's make sure that we get on the other side of this curve. But now is the time. And like I referenced earlier, even in the middle of World War II, I mean, look, 1942, they started the discussion, but they still had 3 more years to go before the surrender was signed. So, we got to come up with our Marshall Plan of this period. And, hopefully there are some progressive things that come out of it that can help society. And if history again repeats itself, we'll get something a la what the New Deal was. We'll get some push when we turn to the federal government to help us. And I mean, I'm not as big of an advocate as you are as far as the government being in every single aspect of my life. I sure as hell don't want that. but there are times where we need the federal government to step in, and this is not one of them. And we need to have a period of thought and discussion on how do we really fundamentally want the rest of our lives to look, because this is an opportunity to make some really major changes that could be beneficial and be a little bit more risky than in the past. And I think there's political clout to be able to make some changes that can at least lay the foundation to get where we would eventually want to go. And we got to take steps in order to get there. And it's got to start somewhere, and, you know, utilize the institutions that we have already and expand upon them. Don't stop funding certain things and you know, rolling back certain things in the environment and the healthcare and overall what we're doing to better society and keep us safe and healthy and happy. And I'm confident we'll get there, but again, we got a long way to go. And there's a bigger discussion to have as time evolves. But now's the time. I mean, I think we're doing everything we can. We're all hopefully staying at home and adhering to what the scientists and the doctors are telling us to do. And we see the results of that worldwide. We see the results of that here in America, and we're starting to see that the sacrifice we've been making will make an impact to get us through this. But we have to have the discussions now in order for what's in the future. So I think I'll leave that right there as well too, and let that marinate to our wonderful listeners and viewers. And
oh yeah, there's a lot I'd like to, there's so much more I'd like to say, but I think we'll save it for next time. So much more, always so much more.
Always. But happy Passover to the world, happy Easter to the world.
Happy Passover, everybody. Yeah. Happy Easter. And happy, if you're not celebrating any holidays, everybody out there, I mean, we all live a lot of different lives, and some people have more opportunities than others. Some places it's not even, you don't really have the ability to social distance or something like that. You have to go to work, or you just live on top of each other. You know what I mean? There's all kinds of different situations going on, but just try to do your best to work together with the others around you. And if that means not working with them right now and not saying hi to them and not talking to them or whatever, then do that too.
Beautiful.
All right, everybody. Well, Screamin Eagle, thank you for coming back on the show today. I mean, this is our show. And we'll be back here real soon, everybody. We're going to try to be back in less than a week now. So stay tuned to the Progressives Abroad Facebook page. You can like us on there. Please subscribe, and also don't forget to hit the bell so you can get all the updates when we're doing our next live streams and our next shows right here on the YouTube page. As well, you can follow us on Twitter, and always hit us up on our podcast, which is on Anchor and Spotify. Feel free to hit us up, everybody. Don't forget to give us a shout. Send us your comments. Send us your questions, send us your objections, and yeah, just give us a shout. Peace, everybody. Progressives Abroad, over and out.
Love. Stay safe, stay home.
Yes.